Hi, here we will discuss nervous system, anatomy and physiology. Normally, anatomy and physiology is a vast topic, and most of the students they feel nervous system as a complicated topic. But if you study nervous system in a systematic manner, you can feel that nervous system is an easy part. So here we are going to discuss nervous system in three parts. So this is the first part, nervous system, anatomy and physiology, first part. Nervous system classifications. You can see nervous system classification like different branches, but here we'll go by step. So nervous system, you can see nervous system. The main classification is nervous system can be classified into central nervous system and peripheral nervous system. Central nervous system and peripheral nervous system. The rest of the divisions we will discuss later, but now you just understand that nervous system is divided into central nervous system and peripheral nervous system. Okay, what is central nervous system and peripheral nervous system? So this is the central nervous system. Actually, central nervous system, it includes a brain and spinal cord. Okay, so just think that there is a central nervous system and there is peripheral nervous system. Okay, so this is peripheral nervous system. There is two part for the peripheral nervous system. One is sensory part and second is motor. Sensory part and motor part. So central nervous system actually it include a brain and spinal cord. Brain and spinal cord. So what happen means when there is any information, any impulse, all those things will be taken by peripheral nervous system, the sensory part of the peripheral nervous system. So it will take impulses or informations or signal towards, it will take to central nervous system. So the informations or impulses will reach or signals will reach central nervous system, and in the central nervous system the brain and the spinal cord. So these mainly the brain will process that information. They will check the information, they will process the information, and they will send some response. They will send some response to different parts of the body. So the sensory nervous system, the peripheral nervous system sensory part will take information to the brain, and from the brain a lot of actions or response will go to your different parts of your body. That also going another branch of peripheral nervous system, that is a motor system. So peripheral nervous system is bringing some information to the brain, and the brain is giving some order or a response to peripheral nervous system, means through motor section. Suppose okay, you are hearing some noise, or somebody is calling you, so this noise is coming to your central nervous system. How it will come? Through peripheral nervous system it will come to your central nervous system, and central nervous system will identify that sound or call or whatever it is. Then central nervous system give action to your body to respond to that call or respond to that noise. Maybe you will turn back, or no, sometime you will run, whatever it may be. So this central nervous system will give some action, that is response to your body. So these are the main systems. So one is central nervous system and peripheral nervous system. As I told, peripheral nervous system will bring some information to your central nervous system, and the central nervous system will process that thing, and that information or that response again will go to peripheral nervous system, and peripheral nervous system will act accordingly. If you see, you can see here central nervous system include two things: brain and spinal cord. Brain and spinal cord, they will process the information, they will process the information. Whatever the information reach to brain, they will process that thing. Okay. Next, we will see important structure or important divisions of a brain. So, I have given you a simple anatomy or structures of brain. You can see here brain divisions. Okay, so this part is called the cerebrum. The outer covering is called the cerebrum. Then you can see here thalamus, hypothalamus, then pituitary gland. Then you can see pons, medulla, then cerebellum, then spinal cord. All those structure. Okay, so here we will see the divisions of brain. The entire brain we can divide into three category. First one is forebrain. So from here, from this part, this is called as forebrain. Okay. So there is another name for the forebrain, that is prosencephalon. The name is prosencephalon. For the other name of forebrain. Okay. So this forebrain itself we can divide into two parts. For the forebrain itself we can divide into two parts. The outer part, see this outer part. This outer part is called as telencephalon. The outer part is called as telencephalon. Then the inner part, see this is the inner part, which is called as diencephalon. Okay. So I'll repeat. The brain is having different divisions. Okay. The first division is forebrain. Forebrain is, you can see the structure, the boundary of forebrain. So this is the boundary of the forebrain. Actually, the forebrain it include cerebrum, then thalamus, hypothalamus, all those things. So all this entire area is called as prosencephalon or forebrain. And again, this forebrain is divided into two. The outer area is called as telencephalon and the inner area is called as diencephalon. Okay. Next comes the second part, that is midbrain. See, this part is called midbrain. In the midbrain, you can see different type of centers for the visual or auditory centers. Tectum and tegmentum. You can see tectum and tegmentum in the midbrain. Then the last part is called, this part is called midbrain. The other name of midbrain, this is called as midbrain. Other name of midbrain is mesencephalon. Other name. So this is the midbrain. And the last one is hindbrain. Hindbrain is called as rhombencephalon. So this part, the last part is called as hindbrain. The other name of hindbrain is rhombencephalon. Rhombencephalon. So in rhombencephalon you can see medulla, pons, then cerebellum, all those things. So I repeat, there is three part or three division. One is forebrain, then midbrain and hindbrain. The other names for forebrain we will call prosencephalon. For midbrain we will call mesencephalon, and hindbrain we call rhombencephalon. The forebrain itself divided again into two. One is telencephalon and the other one is diencephalon. Telencephalon include the outer area and diencephalon is the inner area. In inner area you can see hypothalamus, pituitary gland, pineal gland, etc. Then midbrain. When midbrain is the middle part, it includes lot of reflex center for auditory, all those reflex center or relay center, tegmentum. We can see tegmentum, tact and tegment in area in that midbrain. Then the last one is hindbrain, or the other name is rhombencephalon. In hindbrain, you can see the parts. You can see pons, medulla oblongata, then cerebellum. These are the different divisions. Okay, next we will see some of the important structures. So far we have discussed what is nervous system, different parts. Then I discussed mainly we discussed regarding central nervous system. The first part, central nervous system. So I told in central nervous system it include brain and spinal cord, and I told different divisions of brain, and we can see structures, different structures we can see in the brain, different structures. Okay, first one is a cerebrum, then cerebellum, then brainstem. Okay, we'll go to this picture. Here you can see the outer part. This is the cerebrum, and you can see here cerebellum and brainstem. The third part is a brainstem. Okay, so we'll see here again. Cerebrum, you have seen the cerebrum. Where is the cerebrum? Then cerebellum also seen. Then brainstem. What is brainstem? Midbrain plus pons and medulla. Midbrain, pons, medulla, or medulla oblongata. These three together called as a brain stem. If somebody asks you what is brainstem, you have to tell that it include midbrain plus pons plus medulla. Okay, so there are three important structures in the brain. One is cerebrum, the outer cover, it is called cerebrum, then cerebellum, then a brainstem. Okay, now we will see what is cerebrum. Cerebrum is the largest part of the brain, very important. Cerebrum is the largest part of the brain, and this cerebrum, entire cerebrum, suppose this is cerebrum, you can divide it into a right and left hemisphere, and if you see the cerebrum, you can see a wrinkled type of appearance. See here you can see a wrinkled type. See here you can see a wrinkled type of appearance. This is called as gyri. Okay, then corpus callosum. If you see the cerebrum, within the deep inside, or within the cerebrum, the both right and left hemisphere is connected by a group of white matter. So if you take the cerebrum or cerebral hemisphere, this is a right and this is a left, and deep inside both these hemispheres are connected by whom? Connected by a group of white matter that is called corpus callosum. So corpus callosum connect the right and left hemisphere. And then if you see the cerebrum, there is a two type of structure. Again you can see cerebral cortex. Sometimes you may hear cerebral cortex, basal ganglia, so you may get confused. What is cerebral cortex or what is basal ganglia? Okay, cerebral cortex. So this is the cerebrum. You can see the cerebrum. Cerebral cortex is the superficial layer. Cerebral cortex is the superficial layer. If you take the cerebrum, you can see a superficial layer. See, this is the superficial layer. So this superficial layer, it is made of gray matter. Gray matter. We will discuss what is gray matter, white matter later. But remember, cerebral cortex means it is the superficial layer of the cerebrum, and it is made of gray matter. That is cerebral cortex. And what is a basal ganglia? Basal ganglia means at the base of the cerebrum. So this is the cerebrum or cerebral hemisphere. At the base, if you go and see the base, or within or deep inside the cerebrum, you can see a group of gray matter. See, you can see a group of gray matter. Here also you can gray matter surrounded by white matter. Okay, So inside the cerebrum, if you check, you can see a group of gray matter there also inside the cerebrum, and this gray matter is surrounded by white matter. This is called basal ganglia, and this basal ganglia mainly helps in the voluntary movements. It helps in the voluntary movements. So if somebody asks you what is basal ganglia, you have to tell that basal ganglia is uh, present inside or deep inside or base of the cerebrum, and in base of the cerebrum we can see a group of gray matter, and this gray matter is covered by a white matter. So this structure is called basal ganglia. If somebody asks you what is cerebral cortex, you have to tell that cerebral cortex is the superficial layer of the cerebral hemisphere, and it is made up of gray matter. Okay, then lobes of brain. Brain is having different lobes, and each lobe is having different type of functional areas. So depends upon the bones situated near the lobe. They have given the name. Suppose the lobe which is near to the frontal bone, we will call as a frontal lobe. The lobe which is near to the parietal lobe, we will tell parietal bone, we call parietal lobe, and occipital bone we will call occipital lobe, like that. So we will see the lobes and its function. Frontal lobe, the main this lobe or this area is help for the speech, mainly for the helps in the muscle movement for the speech, means motor speech area means this will help you to speak. That is called motor speech area. This will help you to speak, to move your muscles for the speech, muscle movement for the speech, to move your mouth and everything. It will help. That is frontal lobe. A motor speech area, it is otherwise called as Broca's area. Broca's area, they will mainly in the exam they will ask you Broca's area is situated in frontal lobe, very important. Then parietal lobe will help for the interpretation of taste, pain, temperature. Okay, for temperature interpretation, parietal lobe. Then temporal lobe, very important, auditory center. It is the auditory center. Then the other important thing is sensory speech. Sensory speech means otherwise it is called as Wernicke's area, means to understand a speech. To understand, before I told motor speech means to speak. Here to understand a speech or understand a language or understand if somebody is speaking something, to understand that this area will help. This temporal lobe, this area will help. This is otherwise called as Wernicke's areas. Then occipital lobe is for visual area. Okay. Next, so far we were discussing central nervous system. Central nervous system. I'll repeat again. Nervous system. The nervous system is again divided into central nervous system and peripheral nervous system. In central nervous system, we told that there is a brain and spinal cord, and in brain we have seen their division. Then lobes, then main structure. In main structure we have seen cerebrum. Then second one is cerebellum. So here we will see the cerebellum. So cerebellum, just check the cerebellum is situated behind the pons. If you see the behind pons and medulla oblongata, you can see cerebellum, and cerebellum is ovoid in shape, and it helps in the coordination of posture and balance. It helps in the coordination of posture and balance, cerebellum. So just see where the cerebellum is situated, and the other structure related to or near to cerebellum. Then pons and medulla. Pons is situated in front of the cerebellum and above medulla oblongata. So just see where these pons. Just look at the picture and identify where the pon, where is the medulla oblongata, where is the cerebellum. So pons is situated in front of the cerebellum, and above the medulla oblongata. And pon is containing a respiratory center. Pon is also containing some respiratory center which help for the breathing. And The other one is a medulla oblongata. Medulla oblongata, otherwise commonly or sometimes it called as a medulla. If somebody is telling you medulla, it means medulla oblongata. Medulla oblongata, where will be the medulla oblongata? It is situated down the pons. Okay. Then in medulla oblongata you can see different type of centers, center which control. First one is cardiovascular center. Medulla oblongata is having cardiovascular center, very important, because this medulla oblongata will control your heart rate, its force, and it will control your blood pressure, it will control your blood vessel diameter to constriction or dilation, whatever it is. So cardiovascular center is in medulla oblongata, very important. Then the other one is a respiratory center. This is also very important, because it controls your respiratory rate, and that the respiratory center is in medulla oblongata. Then reflex center means sneezing, vomiting, and coughing. All this center is in medulla oblongata. So very important. So please remember these 3 points: cardiovascular center, respiratory center, and reflex center is in medulla. You can some people may have doubt that there is in pons also respiratory center. Yes, pons also having some respiratory center. So specifically, if I say it is in medulla oblongata, there is in pons also we can see respiratory center. Then the last section of the spinal cord, that is last section of the central nervous system, that is spinal cord. So far we have discussed about a brain. Now spinal cord. Spinal cord is the continuation of the medulla oblongata. So down medulla oblongata you can see spinal cord. So medulla oblongata continue as a spinal cord, and it extends from the, so spinal cord is it extends from first cervical vertebra. The name of the first cervical vertebra is atlas. Sometimes question may ask. First, it extends, spinal cord extends or start from first cervical vertebra and ends in first lumbar vertebra. Okay, so C1 to L1. What is the name of the first cervical vertebra? It's atlas, and normally it is a 45 centimeter long, and this is the link between brain and other parts of the body. So who connects the brain and other parts of the body? Who connects the brain and other parts of the body? That is a spinal cord. So this is the link. I forgot to tell you one thing. The average weight of a brain, it is 1.4 kilogram. Okay, 1.4 kilogram is the average weight of the brain. So this is part 1. This is part 1 regarding the central nervous system, brain, and spinal cord. In the next two sections, next part, we will discuss the rest of the thing. Thank you.